Good evening, sir. I am Anne Padernal, your student nurse for today. So may I know your name, sir?
I am RJ Aragon,
Age?
20,
Date of birth?
April 5, 2001.
Okay, so do you know what date today is?
It's May 27, 2021.
Okay, so do you know where we're at right now?
Hospital.
Okay, good. So before we start on doing the abdomen assessment, I'm going to take your vital signs. But before that, I'm going to do my hand washing. Okay, sir? And I'll be right back. Okay, good. And I am back now, sir. And I have all of the equipments that we need in taking your vital signs. But before that, I'm going to close the door for your privacy. Okay, sir. So first, I'm going to take your temperature. So kindly put it under your armpit. Okay. I'll just assist you. So while waiting for your temperature, I'm going to take your pulse rate. Can I have your hands, sir? Your hand here. Okay. Thank you. Okay, so your temperature, sir, is normal. It's 36.7. Don't worry about that. And your pulse rate is 69 beats per minute, and your RR is 16 beats per minute. Okay. So now I'm going to take your blood pressure. Can you your hand? Just relax your hands. Okay, sir. So, your blood pressure is 100/80, which is completely normal. Okay. So now, sir, we're going to start in abdomen assessment. I'm going to expose your abdominal area. Is it okay with you? Okay, thank you. Okay, sir. So, do you feel any pain in your abdomen?
Nothing.
Okay. So, inspecting of abdomen, assess for abdomen temperature, color, Note for any vascularities, stray or stretch marks, and also note for scars, lesions, or rashes. And if there's any, document for its history and its location by quadrant. So now, inspect the umbilical location, color, and contour. So the umbilical skin tone, it is similar to the surrounding skin tones or even pinkish. It should be resist inverted or protruding no more than 0.5 centimeter, and it should be round and conical. So now also observe for abdominal contour and symmetry. So the patient lies supine the bed, sit beside the client, then look across the abdomen at a level slightly higher than the patient's abdomen. So stand at the foot of the bed and observe abdominal symmetry. So the abdomen is normally flat and round or scaphoid, which seen in an adult. So now proceeding to the auscultation of patient's bowel sound. So now, sir, I'm gonna proceed on listening to your abdomen. Okay, sir? So now, auscultate all 4 abdominal quadrants for at least 1 minute each, starting from the right lower quadrant and proceeding in a clockwise pattern. So now, we're going to auscultate for the vascular sound using the bell of the stethoscope. So now, to auscultate for peritoneal friction, rub by using the diaphragm of the stethoscope. Proceeding to the percussion of the patient's abdomen, percuss several areas in each of the 4 quadrants to determine presence of tympany or dullness. So tympany is a high-pitched musical sound that indicates a hollow space filled by air, and dullness suggests a fluid or feces. Forecast for the vertical liver span at the mid-clavicular line. So from the right lower quadrant along the mid-clavicular line, percuss upward towards the liver and note the change from the tympany to dullness and mark its point. So I'm going to mark a here, sir, okay? Now, percuss on the right mid-clavicular line on the area of lung resonance around the 3rd intercostal space. Percuss downward to the liver and note the change from lung resonance to liver dullness and mark its point. So now for vertical liver span at the mid-sternal line, starting just above the umbilicus percus, upward toward the liver, and note the change from the tympany to dullness and mark its point. So now for the upper borders, start percussion at the body of the sternum along the 3rd intercostal space and percuss downwards until the tone changes from flat to liver dullness. Now, we're going to measure the distance between the 2 points. So now, we will begin the light systematic palpation of all 4 quadrants using the finger pads, initially avoiding any areas the patient had identified as painful. So perform deep palpation of the umbilical ring, nothing for any presence of muscles, swelling, nodules, and tenderness. So palpate for the liver. Place the left hand under the client's back of the 11th and 12th ribs, while the right hand laid parallel to the right costal margin with fingertips pointing towards client's head. Instruct the client to take a deep breath, decompress the finger tips upward and inward to the lower border of the liver, and assess for contours, surface, presence of nodules, tenderness, and irregularity. So, sir, please take a deep breath. Again, sir. Okay. So, press in and upward the costal margin with your fingertips and ask the patient to take a deep breath gently and firmly. Pull inward and upward with the fingers. Palpate for the liver edge as it descends the fingers. Nothing for contour surface, presence of nodules and tenderness and irregularities. So, sir, can you take a deep breath? Okay. Again, sir. Okay. So, palpate the spleen and assess for splenomegaly. Stand at the patient's right side and reach over the patient's abdomen with left hand under the posterior lower ribs and pull up gently. Place the right hand below the left costal margin and press in toward the spleen. Ask the client to take a deep breath, then press inward and upward using the right hand as the left hand provided the support. Begin palpation below the costal margin. Try to feel the tip of each edge of the spleen as it comes down to fingertips. So, sir, can you please take a deep breath? Again, sir. Okay. So, repeat the procedure with the client lying on the right side with legs somewhat flexed of the hips and knees as needed. Sir, I need you to turn at your side. So, sir, take a deep breath in. So now, we're going to palpate the bladder. Begin by palpating the area above symphysis pubis and move upward and outward to estimate the bladder borders. So check for rebound tenderness of the kidneys. Did you feel pain as I press your abdomen, or do you feel pain as I release on pressing your abdomen, sir?
There's no pain at all.
Okay.